Just had a mom who was told full stop breastfeeding after a needle stick. To all the clinicians out there who take care of breastfeeding moms, can we please stop reflexively telling moms to stop breastfeeding if we haven't actually looked into the risks first? And yes, there is some risk, and the decision on how to handle this is nuanced, but the reality is the risk to the baby is actually very low. And it deserves an actual discussion because, believe it or not, a lot of moms, once they have a fully informed discussion, will decide they want to keep breastfeeding. And this is just one example. I could give you many more. Of course, there are some very real contraindications to breastfeeding, but honestly, they're a lot fewer and farther between than most people think. Or, maybe mom needs to delay temporarily, but it's actually only hours, not days. And that makes a huge difference. And I get it. Breastfeeding can feel intimidating, especially if it's an area you don't deal with often. Sometimes saying just stop probably feels like the safest answer. But telling a breastfeeding mom to stop breastfeeding or pump and dump is actually a really big thing, especially if it turns out it was unnecessary. If you're prescribing medications, giving anesthesia, IV contrast, therapies, procedure, whatever, breastfeeding safety is really something worth checking on before telling someone to stop. And the good news is there are actually a ton of resources now that can make this easier than it used to be. LactMed, InfantRisk, MotherToBaby, e-Lactancia, all of these are available online to anybody. Plus, you should know there's a whole community of OBs, pediatricians, lactation consultants, pharmacists, people who desperately want to support nursing moms and would love to help if you want to phone a friend. Even expert hotlines you can call for breastfeeding exposure questions. Or honestly, if you don't know, it is completely okay to say you don't know. That is actually an option. Tell mom to check with her OB, the baby's pediatrician, a lactation consultant. We can all help guide her if this isn't your area. Because the worst thing is when someone confidently tells a breastfeeding mom to stop breastfeeding when they don't actually know whether that's necessary. So please don't do that.